Hello, Dr. Zakir with you, Senior ENT Consultant. And the topic for today is vocal cord nodule. And this video will be dealt with in two parts, part 1 and part 2. The part 2 will be mainly I will be dealing with the management, treatment. It can be medical management and inclusive of surgical management. And the medical management, it includes the therapy too. So the rest of everything will be dealt in this one, part 1. So let me give a small introduction first. Everyone, we all have voice box. So when you exhale, breathe out, the air passes through the vocal cords, which are the two structures inside the voice box. These are the vocal cords. This is a drawn diagram, this is a real picture. So when we exhale, the air from the lung, it passes in between the moving vocal cords and we phonate. So this is a picture. I'll show you a video also how it works. So this is nasopharyngo-laryngoscopy, where I'll show you the normal movements of the vocal cord and the normal structure of the vocal cord too. So the camera or the endoscopy, it's introduced to the nasal cavity, and now it's behind the nose, the part called as nasopharynx, and this is the start of voice box, and these are the vocal cords, and you can see the movement, and I'll instruct the patient to say the word E, and you can see the movements of both the vocal cords, and you can see the edge, it is straight. So these are the vocal cords. So let me proceed now. So before starting with the topic, vocal nodule, let me show you a drawn diagram, what it looks like. See, this is a normal vocal cord. These are the normal vocal cords where the edges are straight, and this is the anterior 1/3, this is the posterior 2/3. And if you see the second diagram, here at the junction of the anterior 1/3 and posterior 2/3, you have a small swelling on both vocal cords. And these are less than 3 millimeters in size. See, normally when the vocal cord moves, these vocal cords when they move, the edges, they approximate, they touch each other, and the maximum vibratory effect is seen at the junction of the anterior 1/3 and posterior 2/3. So now we'll go into the topic. You have seen what a vocal cord is. So vocal nodule means is a benign condition, small swelling of less than 3 millimeters in diameter, which develops on the free edge of the vocal cord at the junction of the anterior 1/3 and posterior 2/3. This is what I have been trying to explain. Now this vocal nodule, why does it develop? It is commonly seen in those people who misuse or abuse their voice. Abuse in the sense they shout all the time, they strain their voice. Misuse means you're not talking in your normal voice. That is misuse. So these abuse and misuse, it is seen in this category of patients, in teachers, hawkers, mothers with naughty children, and they always have to keep on shouting at their children, and singers and actors. So what happens? I'll tell you by step what happens in these patients. So to start with, you have voice abuse and voice misuse or voice misuse. So when it continues at the junction of the anterior 1/3 and posterior 2/3, the point or the area where at this junction there will be increased blood flow to that particular area. If the patient continues with the same habit, then later on at that junction fluid accumulates. Second goes to the next stage. And if the patient still continues with the same habit and is not seeking any medical treatment, then what happens? At that particular junction, new vessels are formed. So the patient goes from one stage to another. Next stage, 1, 2, 3. At all these stages, if at any one point of these stages, if the patient seeks a medical attention, he goes to the ENT surgeon and he takes a proper medical treatment, he can revert back to normal. At this stage, second stage or third stage, he can get rid. This means these three stages are reversible. These are the early stages. if even after formation new vessels, he keeps on straining his voice and not seeking medical attention, then he goes to the final late stage where there will be thickening of the covering of the vocal cord, and the number of cells over it increase in size for the protective effect. This last one, that means, is a permanent stage. It becomes the nodule becomes well organized. That becomes a surgical condition. So early stage and late stage. Now the complaints of the patient, they say of late their voice has changed and it doesn't become normal even if there is voice rest for 1 day or so. And when they talk for some time, the voice become tired, they become tired. And they have this foreign thoughts as if something is there in the throat always. They want to clear the throat. They want to cough it out. They have this foreign body sensation, and some of them they may say neck pain which is radiating to one of the side of the ears. These two can be. This complaint also may be one of the complaints. Now these are the common complaints. So when you ask them in detail about their profession, whether they are housewife, how many children they have, so they say we have the use of voice abuse and voice misuse or misuse. Now coming to the examination, so we have to examine the voice box. The best way to do it with a nasopharyngeal laryngoscopy. So I'll put in a camera through the nose into the vocal voice box to have a look at the vocal cord, whether there's structurally or is there any lesion. So if you want to know the preparation, how it is done, the post-procedure advice about nasopharyngeal laryngoscopy, you have to watch my video. You have to type in YouTube, Dr. Zakir Hussain ENT, nasopharyngeal laryngoscopy, you will get in detail. Now, when we do a scopy, it will look like this. This diagram I have already shown you. This is a normal picture, and this is a picture showing vocal nodule. Now, if I show you a video, you will understand better. So, this patient I am going to do a nasopharyngeal laryngoscopy. I am introducing through the nasal cavity. Now, the endoscope is in the nose, in the nasal cavity, and proceeding towards behind the nose, the area called nasopharynx. And once I reach there, I will guide my endoscope down into the oropharynx, that is behind the mouth or oral cavity. Then proceed slowly towards the voice box. Proceed slowly towards the voice box. That is the voice box. That's the start of the voice box. So if you listen, if you see carefully, this is the voice box. If you see carefully, you can see the vocal cords moving. And in the vocal cords, junction of the anterior two-third. So this part, lower part is the anterior. This is the posterior part. Junction of the anterior one-third and posterior two-third. You can see two spots. If possible, I'll try to stop the video there. Now, can you see these two small spots? This is an organized vocal nodule. Means she is in a surgical condition. This is a vocal nodule. Now, higher centers, they would like to do a stroboscopy also, and we have to do a voice assessment also. About voice assessment, I'll tell you in the second part. So that's how we examine a case of vocal nodule. Thank you so much.